So I invite to the stage Chiefs Chris Bator, Sam Eaton, Lieutenant Kenny Schroeder, and Chief Brian O'Neill. Chief Bator began his career in 1996 as a firefighter paramedic and is now Division Chief of Safety and Health for the City of Coral Springs, overseeing employee wellness and safety. He has earned numerous accolades, including Fire Officer of the Year in 2016, 2020, and Lifetime Achievement Award from the Florida Fire Chiefs Association. He's also the co-founder and president of the Florida Firefighter Safety and Health Collaborative, contributing to national and international efforts on firefighter safety, mental health, cancer prevention, and risk reduction. Sam Eaton has a distinguished 30-year career in the fire service, including 24 years as an officer, culminating his role as Health and Safety Officer at Palm Beach County Fire Rescue in 2020, and is the founder of FACE, Firefighters Attacking the Cancer Epidemic, and played a pivotal role in creating a partnership between his department and Sylvester Comprehensive Cancer Center. Currently serving as Cancer Prevention Director for the Florida Firefighter Safety and Health Collaborative, he has expanded the FACE team concept to a national level, focusing on cancer prevention, firefighter health, fitness, mental wellness, and safety. Lieutenant Kenny Schroeder has dedicated his career to the fire service since 1996, serving as a lieutenant with the Fort Mitchell Fire Department and retiring after 26 years with the Independence Fire District. He is a passionate advocate for firefighter health, focusing on cancer prevention, mental health, peer support, and serves as a board member of the Tri-State FACE team. He tirelessly works to raise awareness, provide education, and ensure first responders have access to the resources and support they need to thrive both on and off the job. And lastly is Chief Brian O'Neill. He is a Torches Fellow with the Firefighter Cancer Initiative at the University of Miami Sylvester Comprehensive Cancer Center, serves as the Deputy Chief of Support Services for San Antonio Fire Department, overseeing multiple divisions, including training, safety, and health and wellness. With over 23 years of fire service experience, he is deeply involved in committees focused on firefighter health, safety, and cancer prevention at local and state levels. He also teaches in graduate programs at Oklahoma State University and Embry-Riddle Aeronautic University, and advocates for firefighter wellness as a National Firefighters Foundation advocate for Texas. So welcome all of them to the stage. So when putting, you guys can say, you know, when putting this panel together, it was something that we had talked about, you know, and a lot of the research we've done is what are some key things that we've seen that has driven change related to cancer prevention in fire departments. And one of the biggest things that we've seen is having a either health and safety program, an officer, or one that's really specific to cancer and a cancer prevention group. And so it made most sense to bring these group of gentlemen up because I'll let each of them tell their story from where they're from, but you heard the term a few times in their introductions, FACE, which if you're not local, it's Firefighters Attacking the Cancer Epidemic. And so starting here in Palm Beach County, in South Florida, and bring it to a national level. And we'll hear from each of them and how it's been brought to Texas and the tri-state, which is, remind me? Ohio, Kentucky, and Indiana. And so we're gonna ask them a few questions to see, because you know, it was no easy task. So wanting to hear from them, what were some of the challenges? And if you're looking to create something similar, a cancer prevention team within your department, what are the questions you should be asking? Who should you get involved? And so that's what we're gonna do. So I will start off with Sam, if you wanna start your story with FACE.
Sure, and I'll definitely keep it short. Thank you so much for this opportunity, Natasha, and obviously this is really a pivotal issue regarding trying to get momentum in fire departments. The FACE team was basically founded because we continue to get cancer diagnoses at Palm Beach County Fire Rescue. We were losing firefighters, and we wanted to make a difference. We assembled a team within our own fire department. Basically, anybody at that team had to have a reason to be there. It wasn't just who wants to do this. They were hand-selected. They either had a personal story, they had a personal loss, they knew somebody that had lost their life to cancer, or something to that effect. They also part of our team, when we were starting to build it back in 2014, was to make sure that the team was made up of decision makers, but also different parts of our department. So if you can imagine, we wanted to make sure that operations was involved, training was involved, that the benevolent was involved, that the Firefighters Benefits Clinic was involved, that operations and support services and all the things that this issue touches were part of this conversation. Up into including, which I was against it initially, but Vicki Shepard, my co-chair, said they have to be at the table. Risk management from our own county had to be at the table. We understood that the mountain of issues that we were up against, but we knew that if we united and brought the right people to the table, that we could start to really create substantial changes in our own department and the way we were addressing firefighting and as it related to the exposures to cancer. So that was our challenge on the front side. We also, just similar to Chris Bator, and I'll let him take it from here, but we recognized that it wasn't just a one approach. There was going to be a need to research. There was going to be a need. This is before we had any research institutions connected to us. We had to research the issue. We had to be training about the issue, no matter whatever we could do. We knew there was going to be a component of support if we got a cancer diagnosis. How would we address that? And then one other element that's escaping me right now, but we understand there were several different pillars, 4 pillars that were a part of that process. So thank you for the opportunity. That's just a quick overview of what Palm Beach County Fire Rescue did when we named the initiative Firefighters Attacking the Cancer Epidemic.
So one of the things I think that came up was, a question as you started in your department. How did you branch out to other departments, or was that an idea early on? And then, we can move down the list, but, even Kenny moving to different states, sometimes people don't think, oh, maybe I should bring other people in. But I know, Chris, if you want to touch on that.
So, again, first of all, thank you for having us again. I think this is a great opportunity. We get these questions all the time in direct personal conversations, but it's not very often that we have the opportunity and a platform to be able to share it like this. And very similar to what Sam said, in my own department, it started with the loss of one of our firefighters to cancer. And again, at the time, we had a funeral, and we had firefighters from all over the state come, and I was blown away by how many firefighters were there. And it really dawned on me at that moment in time to say, we do such a great job at funerals. I hate to say that, but it's true, and firefighters in this room are gonna know, we do a great job of coming together when there's a loss. And I started to think, why can't we come together ahead of time to prevent this from ever happening in the first place? Really, that was the foundational piece to really kind of move towards this collaborative spirit and really kind of work with other departments. The other thing, too, is there's often egos. There's often departments are often, working against each other in the sense of the competition level. And I think, what we did was we made sure that we took our patches off and we really came together as firefighters in the state of Florida to really kind of bring things together. And I think once we did that, we really saw a change and a shift because there was so much more in common that we had than we had differences. And some of the competitive edge that we have as a fire service really was kind of engaging in this topic really and really kind of funneled everything in the right direction. So I think those were some things that really helped us move forward. And the other thing is there are a lot of stories like Sam and what these folks are going to share here where we were able to connect the right people throughout the state of Florida who are having these losses and having these stories. And it makes a powerful message, and they really came together because they were all asking the same questions, and that's where it really started.
Yeah, and so then I direct, my next question to Kenny and Brian. I know you guys, came to the symposiums. You were seeing the things that were happening in Florida. What is some of the advice that you have to give? Coming from different states and really starting from scratch. How did you guys get started?
Again, thank you for being here, for the opportunity to be here. So, like all good things in the fire service, why reinvent the wheel when it already existed? So in 2017. Chief Kevin Hardwick with the Glendale Fire Department in Ohio adopted the program in Florida and made it the Ohio FACE team, which was just after a personal loss that he had. A close friend was diagnosed with cancer. So it all started with that passion, and I think that's what is important, is you really have to have somebody that's passionate behind it and understanding the value to be able to approach that to the rest of the department, the area, the region, and the country. In 2022, we expanded and made the team the tri-state face team. So I'm from Kentucky. They wouldn't let me play in Ohio because it was the Ohio face team. Not really, just kidding. But we created the tri-state face team. So it was this regional effort instead of just being stuck in Ohio. We're fighting similar fires. We're fighting cancer. It's similar in all states, not just one state. So that's how we expanded and continue to expand today. So.
Great. Awesome. And I pose the same question to Chief O'Neill, but also what we'll learn about tomorrow is that San Antonio Fire has partnered with Mays Cancer Center, similar to how our Florida firefighters partnered with us here at Sylvester. Can you talk about how you maneuvered that?
Yeah, so I think passion is the key word. You have to, as leaders, you have to find people with passion for something and then remove the barriers for them. And so we have our cancer committee in San Antonio that was formed several years ago because we have lost so many firefighters to cancer. We have a lot that are sick. And so we had a small group of committed, passionate advocates for our firefighters, Hoyt Allen, Dan Bartow, Carlos Escovel. They've been there since the beginning, and then Dr. Hamlin came on later and really helped push us forward. So there's a lot of components to how we move forward. It was a long struggle to get to where we are right now. And it was having that outside expertise with Dr. Hamlin come in and really help us out. So from there, we started to build and we were able to remove some administrative barriers and support the team to pursue that passion. And then what we wanted to do was help our firefighters with a wellness fair and give them some extra checks, mental health, cancer checks to see where we can help our firefighters. So we did that. And what we realized along the way is that there's a lot of fire departments that don't have the resources that we have. And so that's how we started to mirror the FACE team. I learned a long time ago that you look at successful programs or people and you try to mirror it. And that's how you become successful at it as well. Don't reinvent the wheel, follow the way it was already been successful. So that's what we tried to do. And then we were fortunate enough to link up with University of Miami Cancer Center. If you would have asked me 5 years ago, I'd be sitting here right now. I wouldn't have ever guessed it. But it was that connection, that networking that allowed us to link up with Mays Cancer Center. And I think the biggest lesson for any fire department, no matter your resources, is to be open to people, bringing them into your organization to help you, because people really want to help firefighters. You just got to let them know that you need the help and educate them on it.
That's great. And one of the other things that, we've talked about today is collaborating, scientists, firefighters, but also state leadership and government leadership. Can you guys talk about how your groups have worked with state leadership?
I'm going to let Chris take that, but I definitely have something to say about it, but we'll keep it.
Yeah, so listen, I think that was a big part of leadership, labor management. We just heard a great presentation. The last couple of presentations talked about how labor and management are part of that. I think what happened with us here in Florida is there was just an opportunity of a growth swell between the conversation with cancer and certainly mental health. There was certainly a lot of legislative movement happening as well. And a lot of the time, the fire departments are asking the fire chief for the answer. And in these two topics, they don't really know the answer, right? And I think it was important, and listen, that's the reality, is the fire service is the answer for everybody when they call 911, right? We just didn't have the answers. And so I think that really opened the door for research, and certainly our partnerships with the State Fire Marshal's Office and others who really pushed this initiative forward to be able to get research involved. The other question I often get is, like, how did you make the connection with the University of Miami, right? And how did you make this connection? And how do I, in my state, just make a connection with a university? I never thought, like he said, that I would be working with universities, and I work with multiple of them in our state. But I think the reality is a lot of times you don't know where to start, and I think the connection here with anybody, whether you're in Florida or not, is to reach out to UM, and they'll help you make the connection in these other states. The other aspect is these universities do want to help you. They really do. You just may not know who to talk to, and I can tell you from experience, I've gone to different universities and tried having conversations about different topics, and sometimes you're just not talking to the right person. So it's important to really identify who that is within each university. And certainly you have a really good tool here to help guide that direction.
Yeah, and I will just add, I specifically remember, Chris, it was a cold call email saying, I'm starting something called the Collaborative. Would you mind coming and talking for 10 minutes? You know, and it was the same way we started FCI, where I would just cold call fire chiefs and say, hey, we're putting something together. You know, would you like to listen to my spiel about my research study? So, you know, I think coming from both directions is just having that, just make the call. I mean, the worst thing that could happen is someone doesn't answer you or they say no. But, you know, you don't know until you try.
Absolutely. That's awesome.
Did you want to add to?
Just a side note, you know, I never thought I would be in a scenario like this. I never really saw myself being in this position. But, you know, if I look on the stage here, this really is about team. And I wouldn't be sitting here if it weren't for my own department. I've got people from my department here. Fred Manrique's here. Neil just left. Neil Nimchak, Tara Cardoso. There's so many stories about people. And what we wanted to do in our FACE team and what we've continued to do as a collaborative is to find the people that want to be there and help them understand that you're part of this machine. Chris said, I don't know how we got connected to the University of Miami. I know exactly how FACE team got connected to the University of Miami, and it was through Keith Tyson from the Firefighter Cancer Support Network. And I have to tell that story because it is about team. Keith was the first person, Keith Tyson was the first person in our, that was allowed from the outside into our organization to be part of an internal team for Palm Beach County Fire Rescue, our FACE team. He was a component of it. And I talked about support being an important part of this. Nobody could replicate that support at that time to help firefighters when they got diagnosed. So having him in that group was pivotal because here's a guy from Miami-Dade. He finds out that University of Miami is looking to do a firefighter cancer, you know, study, and he's on our team. And he says, hey, I have this opportunity, reaching back to me and saying, hey, can we get somebody down there? So really, I'm pointing out that sometimes what you might consider as somebody as an outsider, might be the best person you could bring into that organization, because just so reach across the aisle, be in that scenario where you're open to that kind of thought process, if it will.
When you guys are putting these groups together, I know we've talked a lot about the right people to ask and collaborators to bring in. Any learning points of people not to bring in, or anyone not to bring into groups?
Yeah, so I think that comes up a lot as well, and I think, you know, when you're first starting out, you really want to keep a lot of that internally until you help this kind of grow organically. And then the other thing is, you know, some of our folks understand this, that, you know, the fire service has a lot of folks that have a different type of agenda, and so you have to kind of maneuver through that very carefully. And so some folks may have a product that they want to sell. Others may want to, you know, navigate you to this type of specific care. And so I think it's important to really make sure that you are doing your research on who you're including in that group. Obviously, starting internally is where you want to go, and I think ultimately organically kind of growing that out. But I highly recommend anybody to have research folks involved in some sense of at least every once in a while providing what is happening in our country, what is happening in our state, what's happening locally within the fire service, and really understanding that. Doesn't mean you have to have a researcher on your team. It just means that you should make sure that you have that connection to know what's really occurring within the fire service.
Awesome. I want to open
something to add to that. Just another side of that is, you know, there's a lot of energy that gets put into this from the first responder, from the firefighter standpoint or the fire service standpoint. And you're building a team of individuals that are like-minded, that have no agenda other than health and safety. It's literally what you're there for. There's so many from industry that want to weave their way into that process. And it's important that we, as the fire service, we're going to promote the health and safety initiatives. We're going to promote the things. We're going to talk about why it's important to take a shower within the hour, why it's important to have a clean cab, why it's important to have a second set of gear or certain types of hoods. We're going to push that all day, but we don't want to be We're not trying to bring people together in our meetings so that we can pitch a sale to them. We're going to pitch the sale, if you will, about the health and safety initiatives, and then industry can take it from there. But I don't think it's very important that there's a delineation between the two, in my opinion, because it keeps that conversation clean, and then there's no, there's less, you know, how would you say?
Navigation.
Less agenda. There's not an agenda there other than health and safety. That's my point.
Great. One of the things, you know, I've noted, I've been on all of your calls. You guys are very consistent with, you know, monthly calls or quarterly calls. Can you guys talk about, you know, some of the things that you do as a FACE team? What does it entail?
Yeah, I'll go ahead. So we have monthly training meetings. It's the fourth Wednesday of every month. We have in-person as well as virtual option, and we basically rotate through different stations in Ohio, Indiana, and Kentucky. So it's a 1-hour session. If you're there in person, you get a free lunch with it. So we know that the way to a fireman's heart is through his stomach, so we just like to include that piece, usually nutritional. But each topic is different, and we include all different topics of emotional, mental, physical, spiritual, financial, any type of stressor out there that may be affecting us. We include all of those topics just because we don't live in a bubble. You know, all those things can affect us. And then we also have an annual conference that you attended last year as our guest speakers. And all of this is provided at no cost to anyone that wants to attend. So we are very open to have anyone attend, volunteer career. It doesn't matter. So we just want to spread the message, get the word out there, help educate, and make the service a healthier service.
Chief O'Neill?
Yeah, so similarly, first of all, in Texas, we just launched our FACE team a little over a year ago, so we're still building momentum, but we focus primarily on cancer research, education, but we also focus on the whole firefighter. We like to bring in speakers on burnout or stress because we know that those are huge factors in the overall health of firefighters. Ultimately, we would like to be more collaborative and pass it off to other departments or other firefighters because if you're going to do it right, it's almost a full-time job to do it right, and it's important. So we'd like to advance it in that way. That's the goal, at least.
Yeah, no, you guys are all doing amazing work, and 100%, it is definitely a full-time job, and I love that you guys have such, you know, large teams to help each other out. Any questions from the audience that, I don't want to take all the questions. Any firefighters have any questions about starting a cancer prevention team or a FACE team in their department? Any closing remarks?
I'm just fascinated that you guys rolled out a bunch of candy and cookies during the last two health and wellness presentations. I thought that was really cool.
It was supposed to be a trail mix bar. They added a little more goodies to the trail mix bar.
Yeah, absolutely. I feel like I got to do some push-ups or something afterwards.
And just an apology, I think I started this segment by calling you Natasha. It is Captain Solle, if I remember correctly.
Dr. Solle? Dr. Solle?
I hear you. There you go.
Julius here. So for closing question, first of all, I want to commend you guys because I've seen them grow. I got to be part of it. I mean, we wouldn't have had the green buckets if it wasn't for you guys because you helped me decide what we needed to have in the green buckets and the decontamination kit. So what would you recommend to departments that haven't gotten engaged? Because obviously we got the leaders, like look at San Antonio. I think they've been here for several years, strong, powerful.
Awesome.
So how do we get to the departments? Like, Sam, you've given a testimony before that, you know, if we got decon kits and things like that, but they're just sitting in a closet. So how do we get to those that haven't invested yet? What would you see as ways to make this grow, even continue like what you've started with such momentum? Thank you.
I think just the fact that the director, the former director from the State Fire Marshal's Office is asking the question, it's right back at you. It's leadership. It's really, the more that we do conferences like this and have an opportunity to get the messaging out, if we can inspire leaders to do what is needed to be done. That's how we're going to get this done. If it's at the State Fire College, if it's at the State Fire Marshal's office, if it's at the Florida Fire Chiefs Association, if it's at the FBF, if we have the leadership moving the right direction, it's going to pull, hopefully, the state of Florida and the other states to start moving that direction. I'm proud of Florida. I know that we are, as far as I know, certainly when we did it, that we were the only state that took that type of initiative, and it wouldn't have happened from Coral Springs-Parkland, it wouldn't have from Palm Beach County Fire Rescue or Miami-Dade. It took leadership at the state level to make that happen. So if you're looking to really push this forward in your states, it is creating those alliances with state leadership that's going to start moving the needle for, I believe, for the states that are getting involved. And I think you guys are understanding that too when you're moving your direction. So
I would just only add that there are a lot of informal leaders in every single department. Every single department has somebody already doing this work. They're just not being validated or lifted up or given the opportunity to lead. And I think sometimes the chain of command, the structures that exist, tend to shove things in only one direction. And often folks come to us to be able to speak out and really kind of move that and be a part of the collaborative because they're not able to make change in their own department. So I would say that that's also an opportunity. How this has worked is you've had leadership at the top levels of the state and informal leaders within all these organizations and leaders within the organization, and we're creating this sandwich effect. And that's really the momentum that really makes this move forward, because when you have people like yourself who've put us in a place where we can actually move the needle and allow us to do the work, I think then everybody has success out of that.
That's great. Well, thank you all. Thank you for being here. Thank you for all that you do. I know that it's a lot of work and you're doing it in your spare time. So thank you.
Thank you.